POCSO Act is a theory question asked in the paper 3 of December 2025 DNB examination. So this is recently also in the social media you might have heard of very high profile cases, court cases, and also you might have heard this in some of the movies also. Very important topic which you should be having an idea. Even in the practice also you might have some experience of seeing some of these children having this likely sexual abuse related manifestation. So that is the reason why I am going to discuss this. Hello dear students, myself Dr. Maddineni Srinivas, welcome back to my channel. So let us begin the discussion, and I have taken the maximum content from this article. Okay, so I will leave the link for this in the description. So what is POCSO? It is a protection of children from sexual offences, POCSO Act 2012, and here the child is going to be under 18 and it is the gender neutral, so it can be male or female, and they are certain mandatory legal obligations which the treating dermatologist should follow. So all those important points which you are going to see in this video, very important from not only exam point of view but also practical point of view also. So whenever you see this CSA, it simply means child sexual abuse, and also skin and mucosa are very important identification indicators for the sexual abuse. So that is the reason why we dermatologists should know about this act in and out. Some points related to the legal framework. So we have told it is 18 years of the age as a definition of a child, and how are we going to confirm? School certificates, birth registry, and also the osseous and dental examination, right? And what is the mandatory here? We have to report to the legal system, that is police reporting is must. It could be local police or it could be SJPU, Special Juvenile Police Unit, right? The medical professionals especially should know that we have to report any such occurrence to the judicial system. Confidentiality, remember our names and also whoever is the treating dermatologist or the survivor, their names and all the details have to be completely confidential. And also what is the penalty? There is a penalty if we don't report. The penalty could be ranging from 6 months imprisonment and also fine, or even both, and there should not be any kind of a waiting for the police report or the judicial clearance for the treatment of the survivor, child survivor, right? And you should be knowing the evaluation of the skin mucosa and what are the indicators for the probable abuse of the child. So these are all very important. So we need to examine the survivor child from head to toe. Meticulous examination should be done for all these findings to be noted down. What are all those? So we are going to see one by one. Pediatric STI, sexually transmitted infections in the pediatric age group. So if there are genital warts, condyloma acuminata, genital herpes simplex, secondary syphilis, condyloma lata, and if there are discharges which are due to gonococcal or chlamydial infections, okay, all these are very strong markers for child sexual abuse, and immediately we need to report under POCSO. Okay, so these are all the infections. And if there are some mechanical or physical trauma findings, what could be the petechiae, ecchymosis, some bruises over the body, and also you can see human bite marks. So if these are present, then it is very suggestive of physical restraint or non-accidental force. So if these findings are present, it definitely is not due to some accident. These are all non-accidental, and there is one rule called as bite mark rule. So what does it say? If there is a bite mark and if the inter-canine distance is greater than 3 centimeter on a bite mark, it is highly indicative of an adult bite, right? Coming to the anogenital and the mucosal injuries. So what are these? It could be some kind of a laceration or a fresh tear if the child is coming immediately after the abuse, or they could also be some scarring of the hymen and posterior forehead if it is being reported at a later date. Okay, so these are diagnostic of penetrative or non-penetrative digital, penile or even foreign body assault in the child. And there are certain mimickers of the abuse. So there are some skin dermatosis, the skin conditions, skin diseases in which skin near the genitalia may be altered because of which we may get confused whether this is abuse or whether this is a disease. So what are those? They are lichen sclerosus atrophicus. If you remember, there is going to be figure of 8 whitening and there will be ecchymosis. So please be aware that this is a mimicker for the abuse. Okay, and also we should be very careful to prevent any unnecessary false accusations based on these findings near the genitalia, because it could lead to so much of emotional trauma in the family and also legal battles and all. So these findings are mimickers. What are those? Other than the LSA, so Mongolian spots, phytophotodermatitis, because of some psoralen. Some countries, these psoralens are some irritants, they are very easily available in the wild, in the plants. So these if they are touched near the genitalia accidentally, the marks which they may produce, it may look like it is due to the abuse. Okay, so these things, okay, cupping, coining, these are some traditional healing methods because of which there will be certain marks left. So we should be very careful and we should be aware of the local traditions also. So next, coming to the cutaneous signs of the child sexual abuse. So highly specific for abuse, there are some findings which are highly specific and those which are only going to arise some suspicion. So what are those which are highly suspicious? Purulent, foul smelling, vaginal, urethral or anorectal discharge. This is a very important specific finding in the case of abuse. And also acute laceration, bruising, ecchymosis or ulceration, which can be seen near the genitalia, right? Hymenal injury and healed scars which are involving the hymen, and also deep perianal laceration. And obviously if it is post pubertal female child, girl child, so pregnancy is a definitive diagnosis for the sexual abuse, or even the presence of the semen in the anogenital region. So these are all very highly specific for the abuse, and these are some of the suspicious findings in the case of abuse. What are those? So healed scars are some lacerations in the posterior forehead not involving the hymen. So involvement of the hymen points out towards high suspicion for the abuse. Okay, non-involvement is not going to be highly suspicious, it's going to be possibility of the abuse is there, right? Bite or suction marks on the genitalia or inner thighs, condyloma acuminata, anogenital warts in the children older than 3 years, and also marked dilatation of the anus. So if there was anal sex in the case of the male child, okay, so this can be a one possibility. Okay, so MSM, or even it could be penetration of the digit. So these are going to ultimately lead to the dilatation. There will be marked dilatation of the anus in the knee chest position. This can be observed very nicely in the absence of any chronic constipation or stools in the rectum or the neurological disorders. If in the absence of these, if there is this dilatation of the anus, then it is possible that there was abuse in that most likely male child. Even the girl child also this might be there. Perianal scars not located in the midline. Okay, right. Now coming to the what should be the order in which the collection should be done, from where the samples should be collected, how they should be collected, that also you should be having an idea about forensic evidence collection and documentation checklist. So dermatologists are crucial in preserving the physical evidence needed to secure the justice for the survivor. That is the reason for this sample collection. Apart from the management in the investigations, this is also very important point, especially in the medico-legal aspect of the treatment of the child survivor. History taking, physical examination must follow standard forensic guidelines. So you must also be having some idea about what are the steps which we need to take during the sample collection. So that is why we are going to see that in this case. History taking considerations. During the history taking, so we should be very empathetic, and because a child has gone through a lot of trauma, and not only that, even the guardians are also going through a lot of trauma. So we should be very careful in asking any questions to the patients, the guardians or the child survivor, and we should ask a detailed history regarding what happened, and we should be asking about the type of the penetration, whether it is penetrative or non-penetrative, penile or non-penile. So it should be specific. So this examination obviously is going to be not in the open, but it's going to be in a room. It is a closed room where there will not be any possibility of any other person listening to whatever the discussion is being done. Okay, note the affected orifice and also note and inquire if there was any ejaculation which occurred, so that it will help in collection of the semen, right? And document post assault activities which can destroy the DNA evidence. So like for example, so if it is not fresh immediately after the abuse, if the patient is not reporting, then there could be bathing, douching, urination, defecation, or change in the clothes, which may lead to the loss of the evidence of the DNA. Coming to the forensic documentation and evidence collection protocol. So consent and assent should be taken. Consent written form should be taken from the parent or guardian, and verbal or written assent should be taken from the surviving child. And these are essential legal prerequisites before conducting the medical examination or any photography if required for the evidence base. Precise mapping, that is wherever the child is having any lesion, we should map it onto the body chart. So this is very important. It is going to be produced in the court of law as a evidence, so we should be very careful and we should take high resolution photographs, right? And prevents any subject to misinterpretation during the trial in the special POCSO court. So these are there are some special POCSO courts also. Forensic swabbing. So we should collect and preserve the cellular material, saliva, semen, and the perpetrator DNA. That is whoever is the person whom we are accusing of causing this abuse. That DNA also should be collected very carefully. And what are all these samples which should be collected? Gently swab the orifices, all the orifices, oral, vaginal, anal, urethral, with sterile, saline, moistened cotton swabs. And we should also collect the control swabs from the unaffected skin. And before sealing the samples, we should always dry. Otherwise, what will happen? There can be the damage. Yeah, DNA sample may get degraded because of the bacterial or fungal degradation of the DNA sample. So that's why we should air dry all the swabs, and we should send them not in plastic bags but in paper envelopes. And also you should know this concept of chain of custody. So whenever we are handing over these specimens, we should always do it under seal, and also we should sign on that, and we should give it to immediately the police officer or the investigating officer, IO. This maintains legal integrity, and it will prevent any tampering from happening. So which patient may also accuse on the treating medical professional also. So now coming to the indications for the STIs screening in the case of the suspected abuse. So what are all the screening we should do? Physical assault history, known or suspected penetrative genital or anal assault, perpetrator profile should be noted down. So these are all the points which should be mentioned very clearly, right? Abuse is committed by stranger, unknown person, and the medical history. If there is any STI of that individual, we should note that. Perpetrator known case of STI, high risk group, so these should be mentioned. Why? Because this will help in the management of the survivor child, right? We'll see what is the management, what is the significance of this. So that is the perpetrator, if they are IV drug abusers, and if they are MSM, high risk, all these are basically high risk behaviors and high risk groups, and individuals with multiple sexual partners. And also if there is any family or contact history, sibling or close relative of the child is having STA, that also should be mentioned and noted. Why? Because maybe from that individual also this child may have acquired that STA if it is present, right? Symptomatic presentation, presence of the active clinical symptoms of an STA or previous personal history of a STA should also be noted down, right? And standard investigative workup of a suspected case of the abuse. What all should be done? So here on we are going to have very detailed dermatology related points which you should know. So serology panel for syphilis, HIV, and also hepatitis B, herpes simplex virus. So all these should be sent. Pregnancy screening should be done with the help of UPT in the case of post-pubertal female child. Tissue diagnostics, that is skin and mucosal biopsy, can be sent whenever it is required. So these are all the infections. If they are present, we have to report it, and also remember it is most likely a evidence of abuse. So what are those? Gonorrhea, syphilis, chlamydia trachomatis, trichomonas vaginalis, HIV infection. So all these, if they are present, they are diagnostic for the abuse to be happening in the child, right? And there are some infections which could be suspicious of the possible abuse. What are those? So I will try to use different colors. So these are genital herpes, human papilloma virus producing the anogenital warts, right? So in these cases also we should report to the police, but these are just suspicious, okay? They are not diagnostic of the abuse, right? And there are some conditions, okay, in which happen in the genitalia, but which are not diagnostic of or which are not suspicious of any type of abuse. So what are those? So like for example, in the bacterial vaginosis, and also if the molluscum contagiosum is present in the anogenital area. So these are inconclusive, and we need to just follow up these children, okay? And hepatitis B and hepatitis C, CSA can be considered, it's a possibility, but it is not like that definitely it is due to the abuse. And these are some other conditions where we can suspect a possibility of abuse, and we have to also report to the police, right? Mycoplasma genitalium, Campylobacter shigella. So basically these are all sexually acquired infections. That is the reason why, if you remember, you might have also heard of this SARA, sexually acquired reactive arthritis or Retter's disease, okay? So in which case you have heard of these organisms, Campylobacter shigella, right? So that's why these also should be in your mind. What are the investigations we should do? So they are going to be the gram stain. From what samples are we going to do the gram stain? So it is from the specimen from the pharynx, vagina, cervical, urethral discharges, and also anorectal discharge. From all these, we need to do the gram stain to identify the Neisseria gonorrhea, bacterial vaginosis, and also Candida, right? And you must remember one point related to the pre-pubertal age group. Cervical swabs are not going to be taken in the pre-pubertal children, right? Wet mount for Trichomonas vaginalis and or bacterial vaginosis can be done from the vaginal discharge. We can also do the culture with the Diamond's medium, and nucleic acid amplification test for the chlamydia and also Neisseria gonorrhea, right, from these samples. And if there are any vesicles or erosions or ulcers, it could be probably herpes, so we can send for zinc, or we can do a PCR, polymerase chain reaction, PCR, and also we can do the HSV serology. So what is the treatment of the post assault child? So as a treating dermatologist, we must provide comprehensive care, prioritizing the physical and also psychological well-being. So this is not just some kind of infection or some kind of trauma physically which is occurring to the child. It is also a mental trauma. It could lead to depression, post-traumatic stress disorder. So we should also ascertain these points, and we should send it to any psychologist or a psychiatrist if it is required, alongside the legal reporting. So HIV post exposure prophylaxis, this is very important. It should be initiated within 72 hours of the assault, and of course the regimen is going to be the standard 28-day regimen, okay? So if it is post pubertal female, so we should also give the emergency contraception in the form of levonorgestrel 1.5 mg orally, and STA prophylaxis also should be given according to the age and weight guidelines. Example, single dose of ceftriaxone for gonorrhea, azithromycin for chlamydia. So these are some examples. So related to the exact age and the sex of the child, the treatment may be different. Hepatitis B, if it is the perpetrator has this hepatitis B, we should give the vaccination. And if there is a requirement, tetanus prophylaxis should also be given, and of course, like I have told you, the psychological support must also be given. So what are the infections and what is the treatment protocol? For the case of syphilis, Obviously benzathine penicillin should be given. So these are the doses. I don't want to read them because it will become very lengthy. Gonorrhea, so ceftriaxone can be given. This is the dosage. You can just see the dosage. You can pause the video and see the dosages. Chlamydial infection. So usually in the chlamydial infection we give azithromycin, but in the infants and children weighing less than 45 kilograms, erythromycin is preferred, right? And if it is child more than 8 years, we can use azithromycin or doxycycline, right? Trichomonas vaginalis, metronidazole can be used, right? Herpes simplex viral infection, acyclovir can be used. Okay, so exact dosages you can pause the video and check out, right? And some ethical and legal guidelines which you must remember: do not delay the care. Like I have told you, you should immediately report and we should start the treatment. Management, collection of the specimens, samples, and also treating the patient should be immediate. And remember, there is going to be privacy. Our names or the treating doctor's names, and also the patients, the child survivor, the parents, guardians, none of the person's names should be spelt out, or they should not be told to the media. And even not they should not be recorded in the public hospital, the sheets also, and also they should not be shared with the media, very important. So no direct accusation in the report. Like we should not mention that there was a child who is having sexual abuse. It should not be mentioned like this. It should just be written that lesions are consistent with the friction or bruise of this so and so size. So these details should be mentioned, but not the actual points related to the abuse. And this is the flow chart which has to be followed in the cases of the child sexual abuse. The flow chart is very lengthy, so you can just check it out, or I will put the image in the Telegram and also in the WhatsApp channel and on the groups. So the links are there in the description. You can check out and you can join them. Okay. And there is this SAMVAD which is mentioned in this particular flow chart, if you see here. So what is this SAMVAD? It is a support, advocacy and mental health interventions for child in vulnerable circumstances and distress. So this is a full form of the SAMVAD. So this is developed by the NIMHANS, so it might also be a future question. So that's why I have put the details, but again this is going to become very lengthy video. So that's why I'm just not going to discuss this. SAMVAD is utilized in the POCSO Act during the consent counseling part and all. Okay. So that's it, dear students. I hope this video was helpful. So please do the like button and also do hype this video if you really enjoyed it. Whatever doubts you are having, you can put them in the comment section. And what are the any other topics which you want me to make a video on, you can put them also as a comments. If you're not yet subscribed, please do consider subscribing my YouTube channel so that you are going to get awesome dermatology related content on a regular basis. Do revise this topic because this is very volatile, I can understand. Apart from the infections and the management part, rest of the other things you might not have heard or you might not have read anywhere. So try to again rewatch this so that you are going to get a understanding, and also you will remember to write in the examination. And mind you, this is very lengthy version, so you can just write down, jot down few important points which could give you the 5 marks type of answer for this particular question, POCSO Act. Thank you so much. Happy learning. Bye bye.